for this week. And this week, we are going to be talking about reporting to the governing board, which is a pretty daunting task if you're new in the role and you think, oh, I have to go to the board meeting and I'm supposed to report stuff to them. And what do I report? What do I say? And it's challenging to figure out exactly what kind of information is important to bring to the board, what they already know, what they don't know, and how we can help them to really do the job that they are in the role to do. So let's first, I wanted to spend just a little bit of time about just covering the role of governance in healthcare, the role of the board in a hospital too, and that the role really is to provide a framework that accounts for the processes of governing organizations and businesses, or in hospitals. And a healthcare governance definition includes a system through which healthcare organizations are accountable and continuously improve service quality. So governance in healthcare is essential. And governing boards in healthcare have three primary roles. They're there to establish priorities for the hospital. They're there to make strategic decisions for the hospital, and they are there for the oversight. They are the end of the line. The buck stops there with oversight of the healthcare organization's activity specifically related to quality of care and patient safety. So really important that we bring them the kind of actionable information that is necessary too. But one of the things that's different about boards in healthcare is that many of them don't come equipped with the kind of knowledge and skills and experience that's needed in order to fulfill that role. So we have to help them with that. I wanted to walk through just a little bit about what it looks like for who actually serves on our boards in our hospitals. And there are some differences when we talk about the boards in rural settings versus urban settings. In a rural setting, you're most likely to have board members who are probably local business owners, local farmers, with someone from the local area there. They're likely to be local residents too. More likely than not, they have a finance background and not a healthcare background. They're likely to have lots of personal connections to the patient population that's served by the hospital. They are likely to go to the grocery store and have someone stop them and say, hey, that hospital where you're the board member of, let me tell you about what happened. Compare that to our board members that are likely to be serving on the boards in our larger urban or academic medical centers. They might be relatively local business owners, within many miles. They might not be a local resident. However, just as in the rural boards, they are more likely than not to have a finance background or focus and not a healthcare background. They're not as likely to have as many personal connections to the patient population served by the hospital. It doesn't make their role any less important. And this part about having a finance background, there was some recent studies that showed that only about 1 in 7 hospital board members works in healthcare, and that the majority of them are in finance or business. So important to understand what their background is when we think about the way that we're providing reports to them. Then what are the goals for the board? Are the goals different in those two different kinds of settings? The answer is no. They have the exact same goal: to ensure that the hospital is well run and provides the best care possible. So knowing that's we have the exact same goals, what are some of their responsibilities? So their responsibilities are first and foremost to select, work with, and evaluate the CEO. The CEO of the hospital reports directly to the board. They are champions for the hospital's mission, vision, and values. So we need to make sure they understand what the mission, vision, and values are for the organization. They're there to approve strategies and an annual budget to live out that mission, vision, and values. They are there to ensure quality and safety of care for the patients being cared for in the organization. And they're there to monitor results for compliance, for goals, laws, regulations. You may have different state laws that come into play that the board has oversight for. You might have different goals or regulations from your accrediting body. There are some from CMS, So all of those, the board is really responsible for that. And then let's take a look at a few more of the responsibilities that are on their shoulders, so that they need to adequately monitor the delivery of care and services. So activities that could create risk or harm are easily identified. They have to be able to easily identify opportunities to drive improvement into existing systems and activities. They have to assure that the changes for improvement remain in place over time. They have to assure that there's an effective linkage between different activities in the organization and that they're designed to protect the patients. So that's a lot. We keep talking about they have to assure things, they have to easily identify. Well, that's on us to help them to do that, and specifically on the role of the hospital quality director in the way that we help to equip our board members to be able to better fulfill their those responsibilities. So how can we do that? We have to educate them the same way we talked about providing education to our hospital team, our workforce, in how we what our approach to quality improvement is, our quality improvement methodology. Remember, that was one of the homework assignments, was to develop just a short PowerPoint presentation that walks through your organization's approach to quality improvement, so that you could go out and teach the other folks. Same education is necessary for the board. You're there to be their preceptor, basically. Think about when you have new nurses in the organization, and if we're fortunate enough to have preceptors for them that help to mentor them along the way, you're going to do that too. You're going to help them to understand what's going on in healthcare. Remember, again, they, for the most part, do not have a healthcare background, so they need our help to better understand things. We also need to make sure that we are providing information that activates them to do what's necessary. And that comes in the way that we tell our story through data with them. We have to support them, inform them, even down to ensuring that they understand what the acronyms mean that we use. You know, we speak in a very jumbled, different language of acronyms in healthcare. And so ensuring that your board members actually understand the words that are coming out of your mouth and the words that are on the page in those reports is real important too. There's a couple of really helpful resources that I wanted to make sure that everyone had access to here, from the Institute for Healthcare Improvement, or IHI. That's another fabulous resource for anyone in healthcare quality. If you haven't already gone to their website, if you haven't already downloaded some of their resources and tools, really encourage you just to go to ihi.org. They always have fabulous stuff. And they're a great resource for everything that we do in healthcare quality. And so they've developed a framework to support hospital governing bodies in the achievement of their goals. And so I want to share a few of the guidelines that are contained in the framework, along with some practical strategies for implementation. So while this resource is specifically for hospital boards, they need someone, you, to help them to walk through and understand this framework and what that means for them too. And so at the heart of this framework, this piece in the center are the core board processes. And that outlines the process that if they're well informed or well performed, they're going to enable board members to achieve the vision of effective board governance of quality, which is on the right, and then we have to help them to understand the core knowledge areas on the left-hand side. And then another really key component of this framework is that it includes a way for what IHI calls constructive self-reflection. Just another way of saying do a self-assessment here. And they have a great self-assessment tool for boards. So again, you wouldn't be the one who would be filling this out, but as you're working with board members, and particularly at, say, the beginning of a maybe we've had a turnover in our board, we have a new group in place, or maybe the group's been in place for a really long time, but things are getting a little stale. This is a great opportunity for you as a quality director to say, hey, maybe we should take a look at this framework. I think of this great resource that I found from IHI. Maybe we should go through it so we can start to sort of prioritize where we as a hospital can support our board and be able to provide the kind of support that is most meaningful to all of you. And so just real briefly, the way that the self-assessment is set up, there are 6 domains. I'm not going to read them on the screen here. There's about 30 questions that cover the board's key responsibilities and it puts them on a Likert scale. So, like a 1 to 5 of where they see themselves in there. And then it's a roadmap once they've completed that as an individual board member, then as a whole board, a roadmap for where we need to make sure that the board is focusing their efforts then too, all along, all under that same umbrella of oversight of quality care too. So great, those are great resources there. But now back to you. How can you help your board to effectively govern? And one key strategy that has to start from the beginning is having a better understanding about the types of board members who are likely to be members of your board and the kind of support that they might need as a result. And you will find lots of folks, again, remember, they don't have a healthcare background for the most part. They are probably coming from a finance background or a business background. And so that's, there's nothing wrong with that. We all have our own little internal biases or internal lens that we see the world through. And the same is very true for our board members. And so there are lots of types of board members. The one that is, the gold the unicorn would be our informed trustee. This is someone who shows up prepared, who seeks education, someone who, if you were to bring that self-assessment to them, would say, oh yeah, this is great. Hey, is there other education you can help me to find, maybe through the American Hospital Association or somewhere else, to help me to really do this job the way that it's supposed to be done? This, for the most part, volunteer job too. So this person, they go to governance training, they participate in hospital activities and events too. That's great, but that's not going to be who you're normally going to see in every board member. We're just not. You're going to see some passive ones who are just, they're kind of new, they're not really sure what their role is. So again, they absolutely need our help to help them to understand the role and help them to be able to perform the role well. You're probably also going to have some micromanaging folks, coming from a business background, are going to say, hey, I know we had this big construction project that's going on. I want to make sure. So who selected the contractor for it? I want to get into that. Not really the role of a board member, but if that's what they know, that's where we always gravitate to what we know. You'll have the newbies, you'll have some inquisitive ones. Fortunately, we will end up having some absent ones, and again, that might be an opportunity for a replacement, or perhaps an informed board member there too. So, okay, that's everything about who the board is and what the board does. So now back to us. How can we help our board to govern effectively? So we have to provide education. We have to provide actionable information to them. And we have to provide an opportunity for that constructive self-reflection. So there's lots of ways that we would like for our boards to ensure that we want to make sure that the bylaws include some documentation that the board has oversight for quality and patient safety. So it's already there in the rules, in their bylaws there. We then on our end develop an annual quality plan that we bring to them. And it's not just, here you go, here's our quality plan, can you please sign off on it? We want them to be active participants in that plan and really understanding what that means. And give them an opportunity to have them be participating actively in the design of programs here too, if there's availability from them. So when we talk about education, what kind of education is needed to help them to effectively govern? We want to make sure that they have education about just overall responsibility for governance. So here's what it says in the conditions of participation. Here's what it said. Here's some, and you don't have to recreate this. There's lots of educational materials out there that you can utilize, whether from IHI, American Hospital Association. I'm sure that your accrediting bodies, whether that's Joint Commission, DMV, they'll have lots of other information that's available for your boards. Everyone wants your board to be successful, and so there's lots of assistance out there. Also, again, of course, educating them on quality and patient safety principles. Use that slide deck. That's why it was developed. Perhaps you develop a one-pager that could be sent out to your board members every time you have a new board member. I would really encourage you to set up time individually, just to set, even if it's just an hour. Hey, I'd love to talk with you about what's going on in quality and patient safety in our organization. I'm responsible for it here, and I'm your partner to help you to have the best type of oversight in it. Also, we need to give them some education about operational accreditation licensing requirements, just like we do for the rest of our staff. Or that was another piece of education to our staff. We talked about getting ready for surveys. Make sure your boards are involved in that education too. They need to have the exact same kind of education that the rest of our team does. Healthcare finance principles, that's really important for them to understand. You might not be the person that does that, but ensuring that there is some education there. So that's likely to be coming from, say, your CFO or someone else in your executive team who can help with helping them to understand healthcare finance principles. Which, even though I said that many of our board members come from a finance or business background, healthcare finance is very different from any other type of business. So making sure they understand like revenue cycle and that kind of stuff is great education for them. Okay, so now down to how do we provide reports to them? And you heard me at the beginning of this say that I sent a message out on our listserv last night saying, hey, does anyone have examples of the kinds of what your board report looks like? And I have lots of examples that came in too. I'm going to send all of those out for you too. That there isn't just one way of doing this. It's going to be different in every organization, and it's going to be different because you have different boards and you have different goals and different priorities in your organization. But one thing that you will notice is that all of them really distill the vast amount of data and report and information that would go to, say, your medical staff committees, your quality councils. There's lots and lots of minute detail that goes there. The board doesn't need the minutia. The board needs the big picture with just enough information to be able to see, okay, so how do we compare to others? So benchmarking information. How are others doing this too? Are we above the curve, behind the curve? Generally, in a board meeting, quality is one piece of the agenda, not the entire part. You may only have 5 to 10 minutes for your report to the board. So you want to keep information short but smart. What exactly do they need to know? And think about, here's what I want the board to do. Here's what I want the board to know from my report. And then, translate your report into something that is information that's very actionable. Leverage technology if you can too. That not everything has to be on a piece of paper. Most of you probably now use some sort of presentation in your board reports. And just an example of what that might look like then too is this inverse triangle here too. Starting at the top, we have in the microsystem, we have lots and lots of detail at the patient level, at the unit level. Then that medium, the meso system, we get a lot of reports from our departments and service lines. Those are the reports that go to our quality council, that go to medical staff committee meetings too, where we're seeing over time what's happening in surgery, what's happening in maternal health care, what's happening in the ICU care. And distilling this again to the big dots. The board needs to see the big dots, not the little dots. Another piece that's important too, that you will probably get some pushback, is that when we're bringing information to a medical staff committee meeting, there's legal protection for what is shared, specifically when we're talking about peer review and talking about adverse events. That is protected information. So the committee members in those meetings feel a little safer about speaking up and being perfectly transparent and open and honest. That same legal protection doesn't necessarily pertain to our board meetings. That doesn't mean that we shouldn't be sharing all of the information they need. It just means that our reports to the board shouldn't include specific detail down to like patient identifiable kind of information. And there might be some pieces that you're going to do in a verbal report. You're going to have to give aggregate information as opposed to individual patients. So what I mean by that is your report should absolutely, the board needs to know that you've had sentinel events that have occurred. They don't need to know that we identified that this was a result of this issue and that issue, and this person was engaged and this person was involved and that person was involved. They just need to know. And overall, we had a surgical incident that occurred. We have been able to find out that it was related to a process that was not being followed. Here's what we've done to change that process now. So see that there's kind of a difference between what we would present in a quality council meeting or in a medical staff meeting as opposed to a board meeting. So again, I don't say that to scare you or anything like that. It's really just that you just have to think through a little bit differently about the way that the reports to the board look. And that's why we use a lot of dashboards. We don't necessarily have, long-winded, lots of wordy reports for them, but it must be actionable to do. We also want to make sure that our reports to them include benchmarking and risk adjustments to select topics. And we all know that benchmarking is a quality improvement activity. We might think we're doing great, and you might present a report to the board that says, "Yep, we only have a I don't know 25% mortality rate for our sepsis patients," and they might say, "Oh, okay, that still seems high, but okay." But unless they saw that there's a difference between us and other area hospitals or other hospitals like us across the country, that's not actionable information for them. They aren't going to know, how do we compare to others, and do we need to make a change, and also provide some really meaningful targets for them too. We're here, and this is where we're trying to get, and here's what we need to get there too. And have that way, the board is your friend, the board is your support there too. And then also, we need to make sure that the board has access to data beyond what we're able to pull out of medical records and out of our regular charts and graphs that we give them. Find ways for your board members to get engaged in your quality council, to get engaged in your PFAC if you have one, or focus groups that you're using with patients around. Let them participate and see how things really happen in your organization, because that's part of that education too, that's going to help them to really do what it is that they need to do in order, have the kind of oversight that they need, and truly understand what's happening on the ground then too. There are lots and lots of resources that I'll send out that you can have here too, in addition to all of these examples of what these kinds of board reports might look like too. And then as we bring up any questions that you might have too about this, we'd love to have you just put them into the chat or unmute your line. And while you're thinking about questions, I wanted to just go over really quickly what the practical application and the homework is for this week. And remember, our homework assignments are truly meant and designed to be something that helps you to be better prepared for the role that you're in too. And so as a hospital quality director, you absolutely have the right to be reviewing governing board minutes from the meetings. If someone tells you, and if you are actually, the hospital quality director, and someone tells you, "Oh no, you can't see those minutes," that's you actually do need to. So reach out to me separately, and let's problem solve that for how we might approach that there too. How we might help to educate the rest of your organization and your organizational leadership about that. But what I want you to do is review your organization's governing board minutes from the past 6 to 12 months, whatever you have time for. And then think about review based on your review of those minutes. What do you think the board believes to be the organization's priorities? They're only able to prioritize what's in front of them and what's been shared with them. So based on what they're seeing, do you think that their priorities are the same as yours? Do you think that they have the information needed to adequately have oversight over quality and patient safety in the organization? Are there other types of reports and other information you might share with them for that? And then, do the reports that the board receive, do they contain that actionable information? Can they see where they need to make a decision or ask some clarifying questions and provide oversight properly? So that, obviously nothing to turn in, but that's the exercise